Oreo cookies lowering cholesterol by 71%? Have you heard of it? Here's Dr. Ken Berry's brief interview with Nicholas Norwitz, who completed his PhD at Oxford in physiology, anatomy, and genetics.
Do you think? I think that'll work better than a statin if I just eat Oreo cookies. And I'm going to throw up the visual while you kind of explain how you had this idea and how you then proceeded to do this study.
Thanks, Ken. So I'm going to start by not burying the lead and going with the results. And then we're going to kind of backtrack, put some framework around it because there's years of history behind it. And of course, we want to caveat appropriately. But the results were, I did a crossover experiment, which you can see here. What you're seeing here is I had a 2-week run-in on my standard ketogenic diet, but I then standardized it. So that was controlled. And then I did 2 treatments. The first, actually, I'll talk about the second one, which you can see in purple. Standard statin therapy. See how much me, a lean mass hyperresponder, if you don't know what that is, we can define it, is affected by statin therapy. And what you can see is I had a reduction of about 32% in my LDL, which is in line with what you expect from statin therapy. Now, this was a 6-week phase. But before this, I did something unusual. And, the spoilers on the page, I did Oreo supplementation. And that's exactly what it sounds like, as in I continued my diet, but then added Oreo cookies. So 12 cookies is 4 servings is 1 sleeve. If you remember, like, the big packages with 3 sleeves. A whole sleeve.
I love how you refer to the Oreos as a supplement. That makes me want to laugh. But now, to be clear, so you continue to eat what would have been your normal ketogenic diet. You just added 12 Oreo cookies a day. Is that right?
Yes.
Okay.
I added 12 cookies a day, so there wasn't a caloric addition. This was intentional. I wanted to do an addition because I didn't want to do a swap. I didn't want to be like, I'm reducing the fat in my diet. Actually, the fat went up a little bit. And the punchline, you can see very clearly here, is I predicted beforehand and said this was my prediction, Oreo cookies will lower my LDL. I didn't know how they compare to statin, but what you can see is they lowered my LDL massively and dramatically in a short time frame, from 384 to 111 milligrams per deciliter. That's a 71% drop in about 2 weeks, which is absolutely stunning. Now, this is, of course, an N equals 1 case report, but if you put it in the context of some of the work we've been doing, including about 8 other papers, including a meta-analysis of randomized controlled trials, and consider the fact that it's consistent with other patient data, which we can talk about and which we've published on, and was something that we predicted based on the principles of the lipid energy model, that makes it, I think, at some level, if not compelling, I would use the word compelling, but if you want to go even more tepid, you could say, like you said, what? This is interesting. I want this to be something that turns heads and makes people ask questions and delve a little bit deeper into the lipid energy model and lean mass hyperresponder, because I think we have a ton to learn in this niche that has arisen out of more and more people trying ketogenic diets, particularly those who are lean. So we can back up a little bit, but that's the punchline. I did a crossover trial in myself and found that Oreo cookies were more effective at lowering my cholesterol, my LDL specifically, than statin therapy.
So you did what did you do? A 2-week washout to get all the effects of the Oreo cookies out of your system, and then 3-week washout study. Okay.
3
So
months.
after the Oreo cookie supplement arm, there was 3 weeks of no Oreos. You continued your ketogenic diet, and then you started 20 milligram daily of Crestor. Generic is rosuvastatin, but that's Crestor for those of you who don't know, or those of you who may be taking Crestor. Now, my next question is for Dr. Cromwell. And for those of you who don't know Dr. Cromwell, he's not just some bystander I grabbed off the street. He is.
Okay, continue for the next short video from Nick right here.
A little bit, and then pass it back off to Dr. Cromwell.
Yep.
I just want to say, when people hear this, they think, implicitly we're trying to place like a value judgment on something. That LDL isn't bad, or statins are bad, make some sort of comparison. I want everybody listening to resist making that value judgment and realize what I'm trying to do. Reflect on the emotions you're feeling, that confusion, that what? And that what we have here are 2 things that seem to present a paradox. That you have what is clearly an unhealthy intervention. I don't think we're tricking anybody into believing Oreos are healthy. This is clearly something like you're eating additional Oreos onto your diet Nobody's going to think that's healthy. And yet, there's a reduction in a biomarker, and that reduction will be seen as good. So you have a bad intervention and a good response. You have to say, even if this is just one patient case, imagine, put your doctor hat on, you're treating a patient. You have, again, bad intervention, good response. How do we reconcile these things?
Yes.
And
anytime you have a dilemma like that in science or medicine, anytime you have a dilemma like that, a paradox, that means that probably one of your
Oreos will increase your blood sugar, and this study of Oreos still awaiting. Something unhealthy cannot be healthy for you, in my opinion. But maybe Ken Norwitz was eating very healthy ketogenic diet, and he needed some sugar and refined carbs in his diet, and when he took it, it responds. He had a good response on it for the first few weeks. I don't think that would continue after a certain time of using these type of unhealthy eating, especially for blood sugar. That will be very unhealthy in my opinion. But we just brought you this, and if you'd like to continue looking deeper at this study, go to Nick Norwitz, and we're gonna put the link to his full video interviews, and you can just follow up with his studies.